The tablet formulation is very popular and widely manufactured, widely used formulation in the oral solid formulations. There are various types of tablets, and as the tablet is a pharmaceutical formulation, it should be safe to use by the patient, it should be effective, and it should meet all the quality requirements. So not only the chemical parameters should meet, but also all the physical parameters should meet the quality. Whenever the tablet formulation is manufactured, there are some manufacturing defects also we can observe there, and the formulation should be free from defects. We should know all these defects during the manufacturing. We should observe it, and we should try to prevent, because as the pharmaceutical formulation is required to be defect free, it should be manufactured easily, and it should not be with any physical defect or damage. The pharmaceutical formulations are required to be safe, effective, meeting all the quality parameters. The quality parameters are the physical parameters, chemical parameters, and the microbiological parameters. The pharmaceutical formulations like tablets are required to be free from the defects. I welcome all the viewers to this informative video on the tablet manufacturing defects. We will also consider the causes and how to prevent this type of defects. So whenever you are manufacturing the tablet, you make the granules, you make the lubricated blend by different techniques like dry granulation, direct compression, roller compaction, wet granulation, or topspray granulation. And then you make the lubricated blend, and then this blend is loaded into the compression machine, and then you make the tablets. The tablet manufacturing may result in visual or mechanical defects, maybe because of the issues in the granulation, maybe because of the issues in the compression, then tooling, drying, and many other defects. So all these defects are related to the lubricated blade, composition, manufacturing process, material properties, then compression machine, tooling, and the process parameters. So all these are required to be understood. The common defects of the tablet formulation are capping, lamination, cracking, chipping, sticking, picking, mottling, double impression, weight variation, hardness variation. You can also add some other defects to your list, and then you can make a notes on that manufacturing defects, their causes and prevention. So now one by one we will understand the defects. I have included some images which I have taken from internet. It is freely available to understand and let you understand the defects. First is capping. So capping and lamination, these two are the main defects. Capping means separation of the top or bottom of the tablet during the ejection. So as image you can see, there is a capping. Causes of the capping are air entrapment in the granules, over-dried granules, high compression speed. Because you need some moisture in the blend to compress it, to make it compact. If the granules are over-dried, that means if your LOD is too low, let's say for example below 1%, then there are chances that capping will happen, because this blend will not have the strength to get compressed. Air entrapment is also a reason. If air entrapment is there, then the blend will not get compressed and it will result into capping. High compression speed will reduce your dwell time, and that's why capping may result in some of the formulations. How to prevent it? So maintain proper moisture level in the granules, reduce compression speed, and correct the tooling and punch setup. Sometimes capping may be because of the tablet shape. Then lamination. So capping and lamination, can be understood side by side. Many of the times we get confused between the capping or lamination. Lamination means tablet split into two or more distinct layers. Causes are air entrapment, excessive lubrication, high compression pressure. Prevention is to optimize the compression force and speed. That means you need to optimize the compression machine parameters, avoid over lubrication, and ensure uniform granulation. So capping is separation of the top or bottom of the tablet during ejection, while lamination is splitting of the tablets into distinct layers. Sometimes the causes of the capping and lamination are same, and the prevention factors are also same. Then cracking. Cracking and chipping. These are the two defects. Cracking means fine cracks appear on the tablet surface. Causes are rapid drying of the granules and the large tablet size. Uneven granule distribution is another cause. Prevention is to control the drying temperature, optimize binder concentration, and ensure the uniform granule size. Whenever you work on the tablet formulation, there should be a binder. It may be binder in the wet form or it may be in the dry form. There should be proper composition. There should be proper manufacturing process. Proper lubrication should be there so that you can manufacture the tablet out of those blends. Then chipping. Chipping is breaking or chipping of the tablet edges. So if it is breaking on the edges, it is chipping. And if you find a crack on the surface, it is cracking. Cracking can be prevented by controlling the drying temperature, optimizing the binder concentration, and ensuring the uniform granule size. Then chipping. Chipping means breaking or chipping of the tablet edges. Causes are low binder concentration, worn or damaged punches, dies, and rough injection mechanism. Prevention is to optimize the binder level, replace or polish the punches and dies, and adjust the ejection settings. By this, you can prevent the chipping. Then sticking and picking. So sticking means granules adheres to the punch surface, mostly onto the upper punch. And picking means material sticks to the punch tip, leaving the marks, especially on the embossed tablets. Embossed tablet means the tablet punch tooling will have embossing and the tablet will have debossing. Sticking means granules adhere to the punch face. Causes are like moist granules if LOD is higher, inadequate lubrication, hygroscopic materials. Prevention is to get the proper drying parameters, increase lubricant quantity, use anti-adherents like talc. Picking means material stick to the punch tip, leaving marks, especially on embossed tablets. Causes are moist granules, engraved and embossed punch surface. So mainly picking you can observe when the punch are with embossing. That time mainly you can find the picking problem. Prevention is to have the proper drying of the granules, polish the punches, add anti-adherent agents. Nowadays, toolings with MCRN coating, CRN coating, multi-layer coatings are available. You can use those and solve the sticking and peaking. Optimize the lubrication concentration and storing the blend and preventing the moisture ingress into the blend. Also, studying the hygroscopicity can give you some solutions. Then mottling. So mottling is related to color variation. So if there is an uneven color distribution on the tablet surface, it is mottling. So mottling is because of the poor mixing of colorant and dye migration during the drying. So if you are using some dyes, those dyes can migrate to the surface during the drying process and then you can get the mottling. Prevention is by uniform mixing of the pigments and then controlling the drying temperature and preferring the lake pigments. Double impression. So if you can see there is a break line and on one tablet, yellow color tablet, you can see 2 times break line is there. So it is double impression. We want only one impression, but it is the double impression. Definition of double impression is duplicate engraving or mark observed on the tablet. Causes for double impression are free movement of the upper punch and loose punch holder. Prevention is by tightening the punch assembly and using the anti-rotation locking mechanism. That is key mechanism for the punches. Whenever you are using the round punches, always use the keys. That means toolings with the keys can solve your problem of double impression. Then weight variation, hardness variation. These are the very common type of problems. Weight variation. As we know that the tablet formulation is a unit dose formulation, and to meet the requirement of assay contain uniformity, we need to maintain the tablet weight. There should not be tablet weight variation. By definition, weight variation is the variation in the weight of tablets within a batch. Causes are poor granule flow, non-uniform dye filling. Many of the times due to machine speed, due to improper parameter setting of the turret speed and the feeder speed can also lead to weight variation. Prevention is to improve the granule flow properties and ensure the consistent feeding of the powder in the dies. You can improve the weight variation by using some granular materials. You can use and you can apply the lubricants, you can use the glidants, and then you can prevent the weight variation. Then hardness variation. So differences in the breaking strength among the tablets. Tablets are required to be sufficient hard to meet the friability requirements and to meet the strength requirements for the proper handling. If the tablet is required to be coated, that time hardness is required. Hardness is required to maintain the handling, transport, and meet the friability. Then causes of the hardness variation is uneven compression force, variation in the granule size or moisture. Many of the times weight variation can also lead to hardness variation. Causes are uneven compression force, variation in the granule size or moisture, and because of the tooling also it can happen. Prevention is by calibrating the compression machine routinely, maintaining the consistent granule size and moisture, and maintaining the weight. Also have the proper control over the compression parameters. So these are some of the common defects in the tablet manufacturing. I suggest you to make your own list of the problems, defects, their causes, and the solutions. Thank you for watching the video.